So our committee has been for the last year studying the care of our ill and injured soldiers as they're returning from theater, and just evaluating everything from the injuries that they experience in theater to how they're treated on the return, and then of course looking at so many of our injuries are invisible as well as the visible injuries, and so we're looking at the whole gamut of operational stress injuries and the more traumatic injuries that people have experienced while they're serving our country so bravely. Well, first of all, I think on behalf of all committee members, we want to express our condolences to the families and the friends and the colleagues of those individuals that have taken their lives. This is timely. This was in the works anyway, to look at just how a JPS unit works, a Joint Personnel Support Unit, and the interpersonnel support centers, and how that serves those members that need their injuries taken care of, and what type of supports are in place. So everything from the military family resource centers, along with the operational stress injury peer review groups, and how they all interact, and how that helps either recover and be able to get back involved as a full-fledged member again, or whether or not they transition out, and how that transition works as they get handed off to Veterans Affairs Canada. So that is the focus of the committee, and we want to be able to put forward some really good recommendations on the path forward, as well as recognize the changes that have taken place over the last 5 or 6 years. Well, I think the government has reacted quite strongly already. We've definitely increased the number of mental health workers by almost twice as many as what was there 5 or 6 years ago. We've also stood up the Joint Personnel Support Units, which weren't in place before. We've have the 24 interpersonnel support centers across this country that are there serving members. And so if members need help, the resources are there to do it. We've increased the mental health budget by over $11 million to now it's a $50 million pool to support mental health service delivery across this country, in all the major bases that have been so involved in Afghanistan and other places around the world. As well, we've increased the overall health care budget for our forces by $100 million. So, all of that it has really been, and you can see it here at Petawawa, that services are there and available, and we have enough mental health workers and clinical specialists to really have a level of service that's beyond anything that's in the public service that we have across Canada.
Okay.